Most women don't know perimenopause can begin years before their final period. Your cycle may suddenly change. Sleep can become difficult. Your mood may feel unfamiliar. Hot flashes can appear while you are still menstruating. These changes are real, and they are not simply in your imagination. Today, you will learn what perimenopause actually is, which symptoms may appear first, why hormones fluctuate, what common myths get wrong, and when you should speak with a healthcare professional. My name is Dr. Chloe Anderson, and on this channel, I explain exactly what is happening inside your body using science, 3D animation, and simple language that anyone can understand. In today's video, you will discover number 1, when perimenopause begins and how long it may last. Number 2, why your periods and ovulation can become unpredictable. Number 3, how changing hormones can affect temperature, sleep, mood, and concentration. Number 4, which common perimenopause myths can mislead women. Number 5 practical steps that can help you understand your personal pattern. Let's get started. This video provides general education, not individual medical diagnosis or treatment. Perimenopause means the transition leading toward menopause. Menopause is not diagnosed after one missed period. It is reached after 12 consecutive months without bleeding or spotting. Perimenopause happens before that point. You may still have periods during this transition. You may still release an egg during some months. You may still become pregnant. Your ovaries are gradually changing their usual rhythm. They may produce different amounts of estrogen and progesterone. Those hormone levels do not fall in a straight line. They can rise, fall, and rise again. That unpredictability explains why symptoms may come and go. Perimenopause usually begins during the mid to late 40s. However, every woman's timing is different. The transition averages around 4 years. It may last approximately 2 to 8 years. Some women experience obvious symptoms. Others notice only subtle changes. Your first clue may be a changing menstrual pattern. A cycle may become shorter. Another cycle may become longer. Bleeding may become heavier or lighter. You may skip several months, then your period may return. None of these changes should make you feel ashamed. They reflect a changing reproductive system, but not every irregular period is caused by perimenopause. Pregnancy, thyroid problems, medications, and other conditions can also change bleeding. That is why your complete health story matters. Next, we need to examine the hormone pattern causing these changes. During a typical cycle, your brain and ovaries communicate through hormones. This communication helps a follicle mature. It helps trigger ovulation. It also prepares your uterine lining. During perimenopause, that timing becomes less predictable. Some cycles may still include normal ovulation. Other cycles may not release an egg. Without regular ovulation, progesterone patterns can change. Estrogen may also fluctuate sharply. Your uterine lining can respond differently each month. That may produce a lighter period. It may also contribute to heavier or longer bleeding. Here is a relatable example. Imagine your period always arrived every 28 days. It now arrives after 22 days. The next cycle takes 40 days. Then 1 month is skipped completely. A changing pattern like this may happen during perimenopause, but it should not be automatically self-diagnosed. A healthcare professional can consider your age, symptoms, medications, pregnancy possibility, and other medical causes. A surprising fact is that one hormone blood test often cannot confirm perimenopause. Hormone levels can change unpredictably throughout this transition. A result taken today may look different later. Testing can still be appropriate for specific medical reasons. However, your symptoms and cycle history often provide important context. Keep a simple record. Note bleeding dates, flow, sleep, hot flashes, headaches, and mood changes. Patterns become easier to explain when they are written down. But here is what most doctors never tell their patients. Now, here is where it gets even more fascinating. Because what I am about to show you next, most women go their entire lives never understanding. A changing cycle is only one part of the story. The same hormonal transition may influence your internal temperature control, sleep quality, emotional well-being, vaginal tissue, bladder, and concentration. Stay with me. First, temperature changes. A hot flash can feel like sudden heat spreading upward. Sweating may follow. Chills can appear afterward. Up to 3 out of 4 women experience hot flashes around menopause. Some begin before periods stop. Second, sleep changes. Night sweats can wake you repeatedly. Hormonal changes may also affect falling asleep. Poor sleep can worsen daytime fatigue and irritability. Third, mood changes. You may feel more anxious, emotional, or easily frustrated. Hormones are not the only possible cause. Stress, responsibilities, and sleep loss may contribute too. Persistent depression or severe anxiety deserves professional support. Fourth, concentration changes. Some women describe forgetfulness or brain fog. In fact, as many as 2/3 of women in perimenopause report memory or focus difficulties. This does not automatically mean dementia. Sleep, stress, and mood can influence concentration. Fifth, vaginal and urinary changes. Lower estrogen can make vaginal tissue drier and thinner. Some women notice discomfort, burning, or painful sex. Others experience urinary urgency or leakage. These symptoms are treatable. You do not need to silently accept them. Your experience may include several symptoms or almost none. Perimenopause is highly individual. Symptoms that disrupt daily life deserve a real conversation with your healthcare professional. Most people believe perimenopause means your hormones simply decline smoothly. But the truth is actually more complicated. Estrogen and progesterone can fluctuate unpredictably before settling at lower levels after menopause. That is why 1 week may feel normal. Another week may feel completely different. Most people believe every woman gets severe hot flashes. But the truth is actually that experiences vary widely. Some women have strong symptoms, some have mild symptoms, others notice almost none. Most people believe a missed period means menopause has arrived, but the truth is actually that menopause requires 12 consecutive months without bleeding or spotting. A single missed period has many possible explanations. Most people believe pregnancy becomes impossible during perimenopause. But the truth is actually that ovulation can still occur. Pregnancy remains possible until menopause is reached. Discuss contraception with your healthcare professional if pregnancy is not desired. Most people believe a single laboratory test gives a definite answer. But the truth is actually that fluctuating hormone levels can make one result difficult to interpret. Testing decisions should be individualized. Finally, most people believe every symptom should be blamed on hormones. That can be risky. Thyroid disease, anemia, pregnancy, medication effects, sleep disorders, and other conditions may cause similar symptoms. New or concerning symptoms should be evaluated. Bleeding after 12 months without a period needs prompt medical attention. Severe bleeding, fainting, chest pain, or thoughts of self-harm require urgent help. Now let us turn this science into 5 practical actions. Here are 5 things every woman should know about perimenopause. Number 1, track your cycle and symptoms. Record bleeding, hot flashes, sleep, mood, headaches, and possible triggers. Number 2, protect your sleep routine. Keep your bedroom cool, limit late caffeine, and follow consistent sleeping hours. Number 3, support your long-term health. Regular movement, strength exercise, balanced nutrition, and avoiding smoking can support your bones, heart, and overall well-being. Number 4, ask about treatment choices. Hormonal and non-hormonal options exist, but benefits and risks depend on your medical history. Never start hormones using another person's advice. Number 5, know when to seek care. Discuss symptoms that disrupt your life, unusual bleeding, painful sex, urinary problems, depression, or anxiety. Seek prompt care for bleeding after menopause. You deserve personalized guidance, not silence or embarrassment. Now you know exactly how perimenopause can change your hormones, periods, temperature, sleep, mood, and concentration. The human body is truly incredible. My name is Dr. Chloe Anderson, and every single week I explain exactly what is happening inside your body, using 3D animation and real science that finally makes sense. If this video helped you understand something you never understood before, please hit that subscribe button right now. Drop your biggest question about perimenopause in the comments below. I read every single comment. Remember, this video is general education. Your own symptoms should be discussed with a qualified healthcare professional. I will see you in the next video.